cancer, types, symptoms and treatment. Myself, Mr. Bhaskar Pathak, Assistant Professor, Dunnoy College, Department of Zoology. Objectives: to study about cancer, possible symptoms of cancer and treatment. What is cancer? Cancer or malignant neoplasm is a disease of an uncontrolled proliferation of cells without any differentiation. A typical change of the cell, uncontrolled cells growth and no differentiation is called cancer. The cancer cells invade and destroy the surrounding tissues. Tumor is any abnormal swelling, lump or mass in the body. The tumor is synonymous with neoplasm, especially solid neoplasm. The neoplasm is the scientific term to describe an abnormal proliferation of genetically altered cells. Neoplasm or tumor is of two types: benign tumor and malignant tumor. Benign neoplasm or tumor is solid neoplasm or tumor that stops growing by itself and does not invade other tissues and remain confined to a particular site. It causes limited damage to the body and is non-cancerous. It divides in an uncontrolled manner though. Malignant neoplasm or tumor, this is the actual cancerous tumor which grow and invade other tissues, showing metastasis. Characteristics of cancer cell. The cancer cell do not require extracellular growth factor to grow and divide. There is no control over the cell cycle, so the cells continue to divide repeatedly. The cells do not undergo differentiation, although divide continuously. Melanin, mucus and fat droplets are more. Cell death is inhibited, so they are immortal cells. The cells pass out from the tumors to a new site for forming secondary tumors. This spreading of cancerous cells from one part to other parts through circulation or by forming secondary is called metastasis. Types of cancer: sarcoma, lymphomas, carcinomas, leukomas, germ cell tumor, blastic tumor, myeloma and melanoma. Possible symptom of cancer: a persistent cough or hoarseness in a smoker, a persistent change in the digestive and bowel habits, a change in a wart or mole, a lump or a hard area in the breast, unexplained loss of appetite, unexplained loss of weight, any incurable ulcer, bleeding in vagina at times other than menstruations, no injury bleeding from the surface of the skin, mouth or any other opening of the body, indigestion or difficulty in swallowing, sore does not heal unusual bleeding or discharge, change in bowel or bladder habits, and unexplained low-grade fever. All above are actually the possible symptom of cancer. Now, detection and diagnosis of cancer. It depends upon histological features of malignant structure. Number 1, FNAC. That means fine needle aspiration cytological technique. It is a very easy and recent method. In this technique, a fine needle used to collect samples of the cells and examine it. Bone marrow biopsy and abnormal count of WBC in leukemia. Biopsy of tissue, direct or through endoscopy. PEP test is used for detecting cancer of cervical cancers and other parts of genital tract. PET scan, MRI scan, that is actually magnetic resonance imaging, CT scan, computed tomography, X-ray are very useful to detect cancer of the internal organs. Monoclonal antibodies coupled to appropriate radioisotopes can detect cancer-specific antigen and hence cancer. Treatment of cancer. Since cancer is not a single disease but cause widespread effect, so far there is not a single treatment and therapies are used simultaneously. Cancer is at present treated in many ways on the basis of cancer, location of tumor, and extent or stage of the disease. The therapies are: number 1, chemotherapy. In chemotherapy, anti-cancer drugs are used as with the produce more injury to cancer cells than to normal cells. These drugs interfere with the cell's division and growth and affect both normal and cancerous cells. Chemotherapy may lead to there have some side effect, that is the hair loss or anemia, but both get corrected after the treatment is stopped. Radiotherapy, it is used in addition to chemotherapy. The basic principle there is to bombard cancer cells with rays that damage or destroy the ability of cancer cell to grow and divide by damaging the DNA within the tumor cells, but produce minimum damage to the surrounding normal tissue. Cobalt-60 are commonly used for the treatment. Surgery. It is removal of the cancerous cells surgically and has only limited usefulness. In breast tumor and uterine tumor, it is most effective. Immunotherapy. In immunotherapy is a form of treatment that enhances the body's ability to recognize cancer cells and destroy them. Number 5, blood and marrow transplant. High-dose chemotherapy or radiation therapy can destroy ability to make blood cells. A blood or marrow transplant can be cure or remove the bone marrow. Hormone therapy. The growth of some cancer can be inhibited by providing or blocking certain hormones. For example, breast cancer and prostate cancer. Removing or blocking estrogen or testosterone hormone is often an important additional use to replace bone marrow stem cells which produce blood cells. Number 7, angiogenesis inhibitor. Prevent the extensive growth of blood vessels that tumors require to survive. For example, a monoclonal antibody bevacizumab has been approved as an angiogenesis inhibitor. Important questions for the examination. Say, what is neoplasm? Number 2, write the difference between benign tumor and malignant tumor. Number 3, write to detect and diagnosis method of cancer. Number 4, write the possible symptoms of cancer. Number 5, what is cancer? Write the to treatment method of cancer and what is chemotherapy. What is neoplasm? Actually, neoplasm means that is the malignant tumor. Actually, tumor two types, that is the benign tumor and malignant tumor. Malignant tumor are actually the cancerous cell. That is the difference. Detect and diagnosis, actually the FNAC, biopsy, CT scan, MRI, that is the detection and diagnosis method. Possible symptom of cancer, already I am discussed. What is cancer? What is cancer means actually that is the uncontrolled cell division. There is no cell differentiation and that is the abnormal growth, that is called the neoplasm or malignant tumor. Write to treatment method of cancer. You may write that maybe surgery, chemotherapy, radiotherapy, hormone therapy, immunotherapy, etc. Okay. Thank you for watching this video, and if you have any doubt or query, then you contact our WhatsApp number 970-727-1107. Thank you from Mr. Bhaskar Pathak.